Nicole Alexandra, CEO of HB Welco. I've got Bree here with us today.
Hi, everyone.
Hi. And Bree is going to talk about some symptoms that she used to have for a few years prior to being diagnosed with Lyme disease in August. And then her journey from August forward in healing herself. So I'm going to hand it over to you, Bree, and why don't you take people through the symptoms that you had prior to learning that you had Lyme disease?
Okay. So I think going through symptoms is so important for kind of understanding Lyme disease because it can vary so much from one individual to the other. So from my personal experience, I had numbness and weakness in one side of my face, and it onset pretty rapidly. So it was very concerning. I immediately went to the ER. This numbness and weakness ended up traveling from my face down to my upper arm, all the way through my fingertips on my right side, and my hands were swelling. So my right hand was visibly swollen. This ended up going all the way down through my leg. So it was very much on one side, so more of like a hemiparesis. So it wasn't full on paralysis by any means, but a very noticeable numbness and weakness. At the ER, they ran all sorts of tests, so blood tests, a cranial MRI, lots of different things that all came back inconclusive. So they sent me on my way, and I followed up with outpatient care. And past that point in time, not only was I experiencing that kind of intermittent numbness and weakness on one side, but I was also having this incredible fatigue where it was not just mental fatigue, it was physical fatigue. And I started experiencing joint pain a few months later. So my knees were audibly popping every time I was going upstairs or squatting down. This was also happening in my hip and my elbows and my neck, you name it, it was spreading. So it was very concerning. I also started hormonal changes. So kind of from an adrenal fatigue standpoint, I stopped producing cortisol. Not fully, but my cortisol levels were very low. So if you look at kind of the stages of adrenal fatigue, people in kind of high stress, fight or flight situation type states, they will have an excess, an abundance amount of cortisol. And after you get to that state, you deplete and you bottom out with your cortisol. And that's kind of where I had gotten. So it affects so many things downstream, and not just from a cortisol standpoint, but also a sex hormone standpoint. My hormones were looking like a perimenopausal woman, and I stopped getting a period. So I had maybe one or two periods in a full 12-month time span. So that was very concerning because I hadn't experienced those kind of changes and problems beforehand.
So at what point then were you actually diagnosed with Lyme disease? How did it finally be revealed, like, oh shit, this is Lyme?
Yeah. So I had gone on thinking that I was going to develop multiple sclerosis just because it was all on one side of my body. I fall into the right like female demographic for it, an age range, and just the fact that I was having this like coming and going of it, these like cycles, waxes and wanes. It took somebody sitting down and telling me, listen, you have every symptom of Lyme disease, especially with that facial numbness and weakness, more like a Bell's palsy presentation, is one of the hallmark characteristics. So that was a really big turning point. And she said, she was just like a guiding light. She said, I'm going to walk you through what you need to do to get diagnosed. I'm going to tell you like what kind of doctor you should go to, et cetera, et cetera. So thankfully at the time I was seeing an integrative practitioner who was focused more on like female hormones.
Yeah.
So, she was just open-minded and holistic. So I went to her and I said, listen, I would like to get tested for Lyme disease. And at this point in time, the funny part is I thought I had been tested. And that's why it never came up again, is because when people are like, oh, it sounds like Lyme disease, I was like, no, I've been tested.
Yeah.
The thing that people need to know about testing is it is very unreliable.
Yeah.
And there is a lot that you need to go into and learn about the testing, because there's two parts to testing. And if you come back negative on the first part, you'll never get moved down to take the second part of this test, which is really where a lot of the true diagnosis happens.
So now take us to, okay, so you've been diagnosed, now what? You know, this is the big thing. Okay, so I finally figure out what this is. It's Lyme disease. what do I do from this point onward to heal?
Yeah, that is a wonderful question. So when that happens, I think people really have to take into account, how did I get sick? Why did I get sick? Am I ready to cut those things out? Am I ready to give that up? If it's a very stressful job, if you live in a house that has mold in it, if you are trying to be, a mom of 3 kids, work 2 full-time jobs, etc. So from my standpoint, I learned a lot about Lyme disease and realized that I wanted to do something that did not involve antibiotics. And that is a very radical statement and very controversial. But when I truly learned about how this disease works, I realized that killing off the rest of my gut microbiome, or really impairing that and putting that into even more or greater of an imbalance, that was not going to make things work in the long run. And that is one thing that you'll find right away with Lyme disease if you start researching about treatment options, is that it's very difficult to treat, it takes a very long time to treat, and you'll often have a recurrence in your symptoms sometime later in life. And I used that as my motivation. I was like, I do not want that to happen. There needs to be a better option. I have to find something else that works on first supporting your body and really building up the foundational materials that your body needs to heal. And then you can start attacking some of the other things. So parasitic, viral, bacterial infections and stuff like that.
And so what did you start with? You started with your diet, you started with your mind, and then your friend. Like, walk us through like the big chunks. I know there's many, many different things that you did, but what were the big steps that you took towards healing? And then talk about bringing in molecular hydrogen into the healing protocol.
Yeah. So first, you don't just want to strip like the life stressors from a job standpoint and whatever else. You want to strip what kind of toxins am I putting perfume on every day? Do I have candles around my house? What kind of makeup am I using? And these are things that are hard for people. Like, these are your everyday things that make you you, and like the things that you like. So you really have to analyze everything. You have to say, is this worth it? Like, do I want to put this candle that causes estrogen imbalance into my home, or should I use essential oils instead? And that's what I did. I really looked at everything and stripped it all away, down to the water you're drinking, down to, trying to diffuse essential oils and things that kill mold and et cetera into the air. Down to my laundry. I was making homemade house cleaning products. I was great.
You went radical.
You
sound like me.
We can't detoxify. You have to make those changes and those choices and sacrifices.
So that's what it is. We're not saying that scented candles and all those other things are we're not saying they're bad, but when your body stops detoxifying the way that your body did, you need to remove those extra added stressors and start there. So
you have to lower the burden.
Yeah, exactly. And that's what you were doing.
Yeah. And so besides those things, then you're looking at the foundational kind of building blocks for yourself. So mineral balancing and replacing, dietary changes, of course. Like even a year before I got diagnosed, I cut out gluten and dairy because one of my other big symptoms was that I had a lot of digestive issues, food sensitivities, you name it. So a lot of gut imbalance. I cut out gluten and dairy, but then it went even further. So one tool that's important too for healing the gut is fasting. So that's a big one, but that is healing on a very different level. You have to set the right intention. You have to figure out, what are your demands for your life for the next 4 days. It's very healing on like an emotional, spiritual, lots of levels. And it is a wonderful tool if it's used correctly. But I would not recommend anybody to just go into a several day fast without thinking about, all those factors. So yeah, those are a few of the tools. There's lots of different supportive supplements and stuff that I took as well in the beginning. So also infrared saunas. There's different types of enemas. There's lots of different tools that you can use to help aid your body in detoxification in the early stages before you move on.
And then we connect, And you're looking for other modalities that are out there that can help you in the healing journey and really get your energy up, because when our energy level is up, we feel great. We can go through our daily lives feeling really positive, and I know that's really important for you and for me as well. So you find molecular hydrogen inhalation, you bring it into your life, and let's talk to us about how it's changed the journey, the results that you're seeing, and let's just talk about why you decided to incorporate it into your protocol.
Incorporated it starting 3 weeks ago.
Okay.
And the turnaround at that point in time, so I was still extremely fatigued. Like, I was having to lay down and take naps multiple times a day. I was having a fever that I had just spiked and ran for a few days. My system came, it went away the next day. So I was still having just a lot of difficulty. I reduced my hours dramatically at my job, and then I finally had to say, no, I can't do this anymore for the rest of the year altogether. Thank goodness I have a flexible job where I have the ability to do that. But once I started incorporating hydrogen, I got energy, immediately.
Yeah.
It was a little bit more inconsistent at first, where I would have energy peaks and valleys.
Yeah.
Now it's getting more consistent, which is amazing. Yeah. And it has no side effects, really. Yeah. And it will reduce your global inflammation, and depending on how you're doing it, it could reach systemically. It's the smallest particle, so it's able to readily cross the blood-brain barrier. It's able to readily cross cell membranes and stuff. So I was like, why would I not incorporate this? This is incredible. The research really is out there.
There's over 1,600 studies that are done right now, and our company is conducting studies as well, and the results are there. Look at you. Look at you right now. Your energy level was at a what prior to molecular hydrogen?
A 0 to 1. It was a 0 to 1.
And what is it now?
Now, so if we're going on a scale of 0 to 5, it would be at today is a 4. Lately it's been a 4.
It's wonderful. In a short period of time. That's it. We said the same thing at the same time. Because when you inhale molecular hydrogen in its pure form, it's able to create that rapid, cumulative, positive result. And you're seeing it after 3 weeks. It's really incredible. Take people through how you incorporated it into your day. What were the durations that you were inhaling molecular hydrogen throughout your day?
Yeah, so start off slow. Anytime you're starting out something new, start off the lowest dosage, start off small, and you can kind of chunk that. So I was doing more 10. So out of with the system that we have, you can do up to 30 minutes at a time.
Yeah.
I was doing 10-minute durations. So then I was increasing to closer to 20 minutes, 15 to 20 minutes. I was doing this several times throughout the day, so I was doing it more frequently at first, maybe 3 to 5 at first of the shorter times, and then just increasing both the number of times and the duration. Okay. And then I started playing with it. So when I had a very tough time after physical exertion, going on a walk, I would use that as an after kind of healing tool. So using that, then I would have a very short recovery time. And when you are depleted and you have all these things going on internally, you just see it. Your hair is dry, it's brittle, my hair was falling out, I had bald spots, and my skin was super dry, my hands would be red and inflamed and have rashes, and that is just improving. You wake up and you're like, I feel like my skin is glowing, I feel like my hair is more luscious, I'm using all the same stuff, it's the hydrogen.
To people that are healing from Lyme disease or healing from really anything, but and because you're speaking from Lyme disease, because you're on this healing journey, is it something you would recommend for them to incorporate?
Absolutely. So when you think about this, I know people do a lot of different protocols, they have a lot of different things on their plate. This is breathing. You just have to sit there and breathe, and you can do it while you're laying down and resting. You can do it while you're doing another intervention for your program or your protocol. It's just breathing. You can do it while you're meditating in the morning. You can do it whenever. It's safe. It's only going to help, and I think work synergistically with the other things that you're doing to make it more effective.
Correct.
And to me, it was just a turning point. It's a huge turning point in my healing journey, where I feel like now I'm able to really engage in life again.
Yes.
And it's huge.
It's amazing.
Yeah.
Thank you. I appreciate you. Appreciate your time.
Thank you so much for this opportunity.
You're welcome. Thank you for sharing.